Hello out there in television land. Welcome to yet another edition of It's Your Health. Philip Benyo with my bride, Kathleen, ready to bring you the latest and greatest in healthcare information. Right, sweetheart?
Right, sweetheart.
Oh, what a doll.
Whatever you say.
She only does that here. We'll be right back after this brief commercial message, and make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health, just like your wife.
What you see here is a very small picture of the Anthracite Model Railroad Society's work to reproduce the anthracite area. It is amazing. It's more than one floor. It's all volunteer work. It's all donations. It's free. So it's in Hazleton. Sammy will give you the address so you can check it out on the internet and find out the hours that it's open. But it is worth it. Hey, is that Santa Claus in that picture?
That looks like
Look at that.
I'm Santa Claus 24/7, yes.
No, you know what? That's grandchild number 11.
Wow.
Uh-huh.
And it's almost like little roadside America, so it's really worth looking.
Oh, yeah, it's
John
really.
Simkovich, you're out there.
Yes, John, you're a sweetheart. Thank you. And it is worth it. It's definitely worth it. So if you're looking for something to go to, check out the American Model Railroad Society, and Sam will let you know what the email address is. Well, the internet address.
Okay, as well as the real address.
Well, the real address is on Hanover Court,
Right.
which is between two other streets.
Yeah, you almost have to be a pizza delivery boy to know where that is,
Yeah,
but they'll find it.
Yeah. Are you a pizza delivery boy?
I was a delivery boy for Andy's Market when it was in session. We would have, a lot of our business was groceries, so yes, I know where that is.
Okay.
Okay, we're going to do some headlines,
What
sweetheart.
was your favorite thing to deliver?
I can't say.
Oh, I'm going to headaches.
Alrighty.
Okay. If you suddenly get a serious headache that immediately becomes unbearable, and you've never had one like it before, it's time to call your doctor. If you have fever, vomiting, loss of coordination, change in vision or speech, weakness, numbness, anything unusual, that's not just a regular headache. And it's important that you find out what it is. And there are a lot of other reasons for headaches too, and Doc will be happy to tell you about those.
Well, there's tension headaches, of course. There's migrainous headaches, and you can get headaches with regards to hormonal changes, PMS, and the like. It can be medicine-induced. But the point is we need a diagnosis, so we need to scratch and try to find one and make sure it's nothing serious, God forbid an aneurysm or a brain tumor, things like that.
You know, and make sure you get the headache taken care of before you realize that it's your husband that's giving it to you.
Is that right?
Because that'll solve a lot of problems.
I thought that was your excuse.
Uh-huh. Okay. What causes cracked heels, and what are some ways to treat them?
Well, we see cracked heels a lot if you're a diabetic, for example. If you have dry skin, you could have a fungal infection. Trauma, of course, can do that. And it's hard for you to know about it because how can you really see your heel? So that's why you need perhaps
Does
a
it
part.
hurt?
It can hurt, yes, it can hurt.
And you know what, they tell you to put lotion on it, and the one that they tell you to use is petroleum jelly. The cheapest one you can get, probably, is the one that they feel is the most useful.
Yep, as usual.
As usual.
I think if you're not any better with your cracked heels, go see a podiatrist because it could be something a little more sinister, but we see it from time to time.
And if your headache is bothering you, or your heels are bothering you, have a glass of red wine.
Ah, yes. Red wine has tremendous healthcare benefits, right?
cancer, heart attack, stroke, diabetes. It has antioxidant properties. It has tannins and flavonoids. It increases the quantity and quality of beneficial bacteria. It strengthens your immune system. But, there's always a but, excessive alcoholism, you don't want to consider that because you could end up with cancer and high blood pressure.
Right.
So
well,
you have to be moderate.
get some Riunite, some Carlo Rossi. I kind of like those myself. So just a little glass at night.
So I guess Boilo doesn't fit in that.
Yeah, that's for holiday use only. You're right.
Okay. It helps to keep you from getting diabetes too.
Yeah, how about that?
Screening for abdominal aortic aneurysms. How do you go about doing that?
Well, the aorta in your abdomen is one of the major blood vessels, probably about 2 fingers wide. But over time, with either hypertension or diabetes or smoking, it can enlarge. And it can enlarge to the point where it will rupture, say at around 5 or 6 fingers. And this is asymptomatic. It doesn't cause symptoms until it starts doing bad things. So we often will send patients who have the risk factors I alluded to earlier for a abdominal ultrasound, which will generally be a good screening technique to pick up a abdominal aortic aneurysm.
And we say abdominal, but it starts in your chest and goes down to your abdomen. So that's
Right,
where bad things happen.
Right. You can have thoracic aortic aneurysms as well. This ultrasound, however, would be used for the lower abdominal one. We do screening tests for the thoracic ones, especially if you have hypertension. That usually would involve a CAT scan or an echo.
Okay, so you don't need that unless you have other symptoms.
I would say I'd like to get it because I don't like to be surprised.
I didn't ever got it.
You don't have any risk factors, sweetheart.
That's what I just said.
I'm your only risk
You're not
factor.
listening to me.
I'm just like I'm at home. Okay.
Yeah, it is, just like he's at home. He doesn't listen there either. Okay, let's talk about dental implants. Dental implants are being advertised on television more and more, and they're taking the place of what my mother and father had. I don't know about yours, which were the full set of false teeth, top and bottom, which I don't know how they endured that and get their teeth out, but that's another story. Anyway, if you're going to get a dental implant and you're older, like me, and you possibly have gone through menopause, and you're a female, your bones aren't going to be as strong to hold that implant. And so it takes some time until that implant settles itself in you. And you have to be careful. You have to use a soft toothbrush, and you have to floss carefully.
Well, it's like anything else. You go low and go slow, and you don't go, eating apples or corn on the cob after a dental implant.
No, and you're be patient for it too. And it has not really anything to do with fibromyalgia, which is something that came up.
Yeah, well, I'm not so sure there's a tie-in between the two illnesses.
No, but you do have pain with the dental implant initially, but that will go away.
Okay, speaking of going away.
I was just going to say that.
You were?
Yeah, I
Okay,
was.
why don't you?
Speaking of going away, we'll be right back. This is a medical cartoon, and she's talking about trying B12, but have you had any luck with a canine? And there's a story, and I'm going to tell this story,
All
so
right,
be patient.
I'm just going to settle out here. Go
Okay.
ahead.
About a man who was caring for his father, and his father was miserable all the time, just cranky and crabby, and nothing made him happy. And this son went to a nursing home and said, "What can I do? I've run out of ideas." And they said, "Well, you're not going to believe this, but sometimes elderly, ill people are lonely. They need a dog. So he went to the pound and he found the oldest dog they had there that wouldn't want to do a lot of running and jumping. And the father's first comment was, "Get it away from me, I don't want a dog." Well, you know, he loved that dog. And he and that dog did everything together. They shared meals, they went for walks, they slept together, and he had a friend. And his whole attitude changed because he had somebody who loved him. And when he did pass away a few years later, he was on his bed and his dog was right next to him. So you never know. The dog may be the best answer to a lot of your questions.
No doubt.
Well, now we have to do real stuff like what is the cause of springtime fatigue, and that's not dogs.
No, it's not. You want to elaborate on this?
Oh, well, we're feeling, we should be feeling up and excited, and it's springtime, and we're going to plant and do this, and we're not feeling it. But the sun has a mood-boosting hormone, serotonin. But we also have melatonin in us, and they are fighting with each other, the serotonin against the melatonin. And we also have a rising temperature in our body because of the sun. Our blood vessels dilate, and our blood pressure drops. It makes us tired. So we eat a lot more in winter. We cut back, hopefully, and we watch what we eat and start exercising. That word is always there. And that fatigue will go away.
Sounds good.
Do you have it?
No, I kind of feel upbeat no matter what the season is, quite honestly. I somehow am insulated from seasons. I think that's because I leave the house early.
You're not insulated from winter. Oh, I'll bet you on that one. Okay, this one's for you. The best foods to eat to avoid clogged arteries.
Well, as fate would have it, believe it or not, sugary drinks were the #1 thing that can clog an artery, besides the obvious, the fats and things along those lines. So if you're into sugary drinks, ixnay.
Approximately 184,000 deaths worldwide every year are linked to people having sugary drinks, and that's me, unfortunately. If you consume more than 2 servings of a sugary beverage, you're 40% more likely to develop heart disease. For men, it's only 20%. And so they tell you, you have to cut it. Cut it with water. Drink less. Drink iced tea, which I certainly don't like. But they tell you to get rid of the sugar.
Yeah, you're sweet enough. Let's move on here, sweetheart.
All right, I'm moving. You're stressing me.
Is that right?
Yes. You know what happens when you stress me?
Good things or bad things? I don't know.
I'll let you know.
All righty.
Okay, here's one I disagree on. Why saying hello to a stranger could be a key to better health. Talking to strangers may be good for our bodies and minds. We are social animals and cannot afford to live without social connections.
Well, around Christmas time, guess what? I tell strangers Merry Christmas. They feel good. I feel good. And so little acts of random kindness, if you will, goes a long way. I know it's a different world out there, and you got to watch who you say hi to. But
yeah, like a serial killer.
He's killing Cheerios or Frosted Flakes. Is this what he's doing? Well, I'm not sure whatever is going on now is working. So perhaps we could turn the pendulum around and start being humanistic and social animals to each other rather than go for the jugular.
Do you know the more you smile, the quicker you recover from stress?
I believe that. So, Merry Christmas.
Thank you. I guess you want to see what else we have, huh?
We only have 20 minutes, sweetheart.
You forgot to mention smartphones are one of the problems we're not talking to people.
That's true.
Because we sit down in a waiting room, and what happens? We pick up our phone, and we don't look up again until they call our name.
Yeah, that's true.
So that's a big one. Drugs versus diet. What is your opinion on Ozempic-like drugs and diets? That's a lot of argument about that.
I tell patients that, look, I didn't give you a drug to put on weight. I feel uncomfortable giving you a drug to take it off. I mean, it's calories in, calories out. And so, but nevertheless, there are some patients who have hypertension, heart failure, diabetes, and need to lose weight and can't. So we turn towards a pill for every ill. And Ozempic is the latest craze, and there's a number of medications like that. So, so far it's working. We don't know the long-term side effects. We don't know what happens when you stop these medicines.
Well, the scientists say that if you stop taking the medicine, you're going to regain the weight.
Plus
More.
Plus more.
Oh boy. They say to stick to vegetables, fruit, the stuff that you always hear, and grains, and stay away from that.
Well, it makes sense.
What happened? That's a terrible feeling if you go to all that trouble to lose all that weight and you stop the medicine and the weight comes back. That would be
horrible.
Really bad. Tell us about these two
Yes.
drugs.
Speaking of which, this is when we prescribe Ozempic, for example, we get refusals from the insurances or the pharmacy because it's not covered, because it's mainly out there for diabetes and whatever. But now there's a drug that has been approved by the FDA for the treatment of obesity, whether you have diabetes or not. And it's called Zepbound. And it's in the same genre, same category as Ozempic and other medicines like that. But this one is specifically approved for obesity, so look into it. It has the same side effect profile. You shouldn't be taking it if you have a history of thyroid cancer or if there's thyroid cancer in your family. But nevertheless, that's something that is something you can look forward to, and hopefully will be covered and you'll get to goal.
If it's not covered, that Ozempic is like $150.
A day? I mean, it's very expensive.
Yes.
Ozempic is, it's actually probably $1,000-ish a month. So, in either event, we're back to our sponsors. Please call our sponsors. Tell them you like sponsoring It's Your Health, and better yet, use their products. So we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Welcome back to the third and final segment of It's Your Health.
Say it to me like that.
I don't know.
I don't have a watch.
Okay. Get a load of that. This picture hangs in my office. Minimum fee schedule of the Hazleton Branch, Luzerne County Medical Society. Office calls, $3. House calls between $4 to $6. And hospital visits were $3. Can you believe this? And premarital examinations, when you had to have them, they should have charged a lot more. $6 for that. And isn't that amazing? Probably something from the 50s, quite honestly. It's not dated, but I have a feeling that's where it came from.
Oh, it could even be before then.
Maybe.
So we can go from that to something totally different. Low sexual satisfaction linked to memory decline later in life.
You got to tell me more about that.
Don't you remember what I said?
Should I?
Well, I hope so. Low sexual satisfaction in middle age may serve as an early warning sign of future cognitive decline. Declines in sexual satisfaction and erectile function were correlated with future memory loss. No wonder you never hear anything I say.
Oh, well, I kind of thought like it was riding a bike, you know, you'd never forget, but I guess you can.
No. If you have low satisfaction generally, you're at a higher risk for health problems like dementia, Alzheimer's disease, cardiovascular disease, and stress-related that can lead to cognitive decline. Sexual satisfaction is very important. We should exercise, it always says that, and we should eat better. Decreases in erectile function and sexual satisfaction were associated with memory decline.
Well, that's good to know, and
But how would you know that?
well, unfortunately, it's after the fact. So I think the word to the wise is stay as active as you can in all respects, mind, body, and soul.
Yeah, but what about when you make me stressed?
Sweetheart, the only stress you have in life, we don't have as much time to go over it.
Oh, do you want to talk about alcohol use patterns during and after the COVID?
It is an interesting study that perhaps not totally surprising that during COVID, the use of alcohol went up,
Yeah.
particularly in veterans that they studied here. You know, alcohol is a funny drug. It is one hydrogen atom off from ether. And of course, what does ether do? It puts your brain to sleep. So alcohol has that effect or side effect of making you anesthetized, if you will. So people out there who wanted to just numb themselves with external events, that's what they used.
Well, an estimated 1 in 5 adults who pass away, it's due to alcoholism. And they're talking about adults from 20 to 49. So they're talking about young people who are dying from alcoholism.
And that's, you know, they've decided or found that probably the best way of staying off alcohol, abstaining from it, would be the AA meetings. But sometimes you need some help and you need some medications. Now, in the olden days, there was a medicine called disulfam, I think, Antabuse. And nobody prescribed it, because if you prescribed this and decided to have a drink, you could become violently ill to the point of hospitalization. Now, they've developed other medications for trying to stay away from alcohol, and they've been rather successful. So check with your healthcare provider. There is a little bit of a laundry list of medicines you can use that will keep you from using alcohol.
Well, that's good. But somebody has to want to stop using alcohol. That's the big thing.
Absolutely. It's just like overeating or over using tobacco products. You have to have at least the will to stop.
Injections of the hip and knee, and why do we give injection? Like if my knee hurts, why do I get an injection instead of them just doing surgery?
Well, chances are it's a bursitis, tendonitis, and why take a pill going from head to toe with side effects? When the problem is localized, we could inject it with a cortisone shot or something along those lines that would relieve the pain and discomfort. And after a series of treatments, if the pain does not go away and your x-ray shows arthritic changes, of course you can then do something more surgical. But this is an easy way in the office to cut down.
You can do it in the office.
Yeah, we do joint injections.
Wow.
Hip, knee, shoulder.
And there's a lot of information about that. The next one is a confusing one too. COVID vaccines, or lack of vaccines, and long-term traffic risks. They're saying that people who refuse to take their vaccine are at a greater risk of having an automobile accident.
That was in the Green Journal, the American Journal of Medicine, very reputable. It's hard to figure out how that happens if you refuse a COVID shot, that you're probably at higher risk for an auto accident. So it must have something to do with your social behavior. I don't know.
It did say that women have fewer traffic accidents, though, than men.
Really? With their cell phone use? I can't believe that.
Oh, believe it. This is an amazing one. This is a big one. Here you go.
Well,
That's a scary one, too.
this mirrors what's going on in society. You know, there are burnout symptoms. People are anxious, they're depressed, and it just
And
is,
mean.
and it just is not relegated to the general population. Here, this study looked at the burnout and depression rate in physicians, and it's quite high. And physicians usually, even though they should heal themselves, won't seek help.
Nope.
Because of the stigmata, if you will, or so they just kind of try to handle it out on their own, which is sometimes difficult and somewhat dangerous. So I think the main point out there, whether you're a doctor or not, if you have thoughts of hurting yourself or others, you must seek immediate help.
Yeah. The percentages on that are really high. Oh, this answers all my questions. How stress affects sex drive and what to do about it. I don't mean what to do about it, I mean the stress affects sex drive. Like if I get stress at home from somebody who lives with me.
Those dogs, I'm telling you.
Oh,
They'll add some
yeah,
stress
the
to you.
dogs, right. Stress and sex drive tend to cancel each other out. If the stress only lasts a short time, your body will recover. But if it keeps going, everything related to sex goes on the back burner, including libido, vaginal lubrication, and even happiness. You may know your stress is mental and emotional, but your body doesn't. As far as your body is concerned, it's a threat to life and limb. So there.
We're back to red wine. How about that? Well,
No stress.
thank you for watching It's Your Health. Hope we entertained you and informed you.
And kept you from being stressed.
Absolutely. Stress kills. What can I tell you? You want to close this up here?
I think you should turn the TV off and put on some music and light a candle, and take the person with you, I'm assuming it's your spouse, and find something to do to get rid of the stress.
Amen to that. We'll be seeing you later. And again, thank you for watching It's Your Health. Please call and utilize our sponsors.
Yes, thank you.